Welcome to 843 TV. I'm your host, Lisa Richardson. Today we have a special show for you. We're coming to you from the Encompass Health Inpatient Rehab Center out in Okatee. We're going to be learning all about the wonderful facility and all the resources they have here. First up, we'll be talking with Bannon, the Business Development Director, along with the new CEO, Rick Molina. Then we'll be talking with the therapy team, Caitlin Moats and Megan Blessinger, and checking out some of the remarkable equipment that they've got to help with patients. Finally, we'll be talking with the nursing staff, Amy Whitus and Haley Kamen. Stick around for this episode of 843 TV, where communities come to speak.
.843 TV, where the Low Country comes to speak.
.843 TV,
where communities come to speak.
We're excited to be back at Encompass Health for today's episode of 843 TV, and we're going to be talking with Bannon and the new CEO, Ricky Molina. Nice to have us come out again.
Thank you so much. We're really excited to have you here with us again, visiting our hospital.
Yeah, we always learn some wonderful things happening, and as you just closed 2019, new decade now, just tell us how the last year wrapped up for you.
Yeah, so it's been a very exciting year for us. We've kind of come through a lot heading into our second year, and we've seen a lot of patients. We've served over 700 patients last year, and we're just really excited and proud to be a part of the community here that we serve, and to be one of the state-of-the-art rehabilitation hospitals in the area.
And when I know later in the show we're going to be seeing some of the equipment you have and talking with some of the therapists, but it's a big time. February is the American Heart Association Heart Month. Let's talk about some of the things that you've got planned.
Yeah, so we'll have a lot of festivities in-house here celebrating Heart Month. That's a big deal for us. We have a national sponsorship with the American Heart Association and Stroke Association nationwide, so that's a big deal for us. We have we're very proud of our stroke program, so we work very closely with the local chapter of the American Heart Association, and we will be one of the sponsors representing our hospital at the Heart Ball that's coming up February the 8th.
Yes.
So very excited about that.
Wonderful event and so forth. Mr. Molina, welcome to the Low Country.
Thank you so much.
You shared that you are actually a native of the West Coast and lived in a lot of areas. Tell us about yourself.
Sure, yeah, so I've been all over the West Coast. I was born in Texas and lived for a long part in Roswell, New Mexico. Joined the military, served in the Marines for a little while, and got into healthcare as a patient first. And have been fortunate to transition into rehab now, and so I was excited to come out here and been here for about 4 months now. Yeah,
and tell us some things that you love about Encompass Health. What drew you to it?
Oh, Encompass Health. So it's a nationwide network. So we cover probably about thousands and thousands of patient encounters, honestly, over the course of the year. It's a great network. It's an expanding network. It is very unique to communities like the one we're in right here. So we provide a service that is very specialized. We focus on the therapy. It's not an ancillary service. It is the reason patients come in. And partnerships like the American Heart Association really just give us a platform to talk to the community and say why we really want to get you into this facility if and when you have a stroke. Yeah.
This particular facility is coming up on 2 years now.
Yes.
And it's been great to be out here so many times. What are some visions, some ideas you have for this coming up in this next year?
A lot of it is community driven, truthfully. What we're trying to do is the second year right now, so hospitals like ours, we've got our own growing pains. We're really trying to find the right talent still, so we're heavily recruiting for people. In the second year, I'd expect us to really reach out to the community, like events like this, get the word out. We are a new service entirely to this county, and so what we're trying to do is make sure people understand what we're here for, how to use us. In the unfortunate event you do need a therapy service like this, we're right here, we're local. Before us, you really have to travel for some of that, and it's a hardship on the families. You got to figure out daycare and take time off of work and things like that. So being local, we can support in a number of ways. So I hope 2020 just results in a lot of community partnerships. We work well with the medical community in this area, and we just want to kind of figure out our role in that and prepare the community for better care.
And there's quite a medical community in this area, isn't there?
Yes.
There's just so many new hospitals and facilities coming up there. And so share with us maybe how you're working with them and partnerships.
Yes, so one of the exciting things actually that's going to be highlighted at the Heart Ball that we're attending is that one of the patients that we all served is going to be honored at the Heart Ball.
Oh.
And so the patient was actually treated in a number of ways within the community. So he was actually resuscitated on site at one of the local restaurants, brought of course to one of the local EDs by EMS, and then he was treated and had surgery by one of the renowned cardiothoracic surgeons here, and then he came to our hospital to complete his recovery and do his rehabilitation. So what's really nice about that, of course, is that he was able to get all of this treatment and rehabilitation that went to his recovery right here in our local community. So that's very exciting.
Yeah, absolutely. Talk about working together.
Yes,
For sure.
yes, exactly.
No, it's a great experience for us. So, and we have numerous stories like that. We actually, this area, as you know, is a very tourist type place, right? So it's great for the economy, but unfortunately, sometimes things happen when you're not planning it. And so, similarly, we've had patients come in and receive some therapy that they probably wouldn't have gotten otherwise. They might have been shipped elsewhere or had to seek care outside of this local area. And so again, it's bringing a service in. Great success stories. We try to invite our patients back in. And just get a kind of a social status check with some of our other patients who just are going through that rough time, and they can relate to somebody who's been there, survived it, and improved through therapy. And so it's just great stories.
And actually, what you mentioned, one of the times we were here previously, we got to meet a patient who was in that situation. He was here on vacation.
Yes,
and he
exactly.
had full treatment here. So it was what a wonderful story. But
Yeah.
as we wrap up, any last thoughts you'd want to share with the audience?
Well, I'm just excited for during this show that you're going to meet some of the additional team members that we haven't been able to highlight. So you're going to get to hear from the folks that are really on ground zero with the patients, helping them reach their goals and get to those really outstanding outcomes that we're proud to say that we have.
Yeah, no, I just elaborate on that. I think our nursing and therapy team is probably second to none, and I say that proudly. I did come on at a later time in September, but it was easy to see the traction had already been there. And so our team is really just gearing up. We got some equipment here that is very unique to our setting. So looking to just, get the word out. We want to make sure people know what's around here.
Yeah, we're going to be checking out some of that equipment that's unique to the facility here. So you all stay right here. We're going to be back with more 843 TV. And we're back here at Encompass Health, and now we'll be talking with two of the therapists who've been here since the facility opened, Megan and Caitlin. Welcome.
Thank you so much. Appreciate it.
Tell us a little bit about your role and how you help patients.
Sure. So at Encompass, I'm the senior physical therapist. So I oversee the physical therapist here, and then we work individually with patients each day to help them with things like walking and transfers and getting back to their normal everyday function.
And my name's Megan. I'm the lead occupational therapist. I work with the occupational therapy team, and we function working on things that are functional, like baking or cooking, dressing, any type of activity you would do in your home. We're going to try and get them back to doing that independently.
Right, obviously, because that's so important. The goal is to get them back to home life and able to live day-to-day activities. So very
Absolutely.
important.
Yep.
What are some of the ways that set Encompass apart from other inpatient facilities?
Sure. So at Encompass, we really like to individualize our plans of cares to each patient. So whatever their interests are that they can do to get themselves home, those are things we want to focus on. For some people that might be cooking and cleaning, like Megan said. For some people that might be getting back to their leisure activities like walking the dog or playing golf or whatever that might be. So those are the things that we want to work on to help get them back to their goals. And so we'll come up with an individualized plan for each patient to accomplish those things.
Give us an idea of maybe an average length of stay for a patient and based on what situation they might be in for.
Right, so it's entirely independent based on the patient, their diagnosis, and a lot of other factors, but the average length of stay is between 10 to 14 days. And we're just gonna hit the ground running when they get in here because we wanna maximize the amount of time that they have here and give them as good and quality of therapy that we can in order to get them as independent. We're gonna keep saying that over and over because that's our goal, and that's their goal too, is to get them
it serves
independently, exactly, to get home, yep.
Well, obviously Encompass has invested a lot of resource and time into special equipment. Why don't we take a look at some things?
Sure.
Show us what's here.
So this is a balance system that we can use.
Maybe step up there. Okay.
So one of the nice things about this is we can do some formalized assessments to see how someone measures up to someone their age if they're at an increased fall risk, because that's obviously a reason that a lot of people end up in a hospital. So for this one, you would be kind of shifting your weight to step forward a little bit for me and space your feet out. There you go. And so now you're trying to shift your body weight to try and hit that new target.
The red.
I
went past. Okay. Oh, there we go.
And then come back. There you go. Good. And forward. And so as someone got used to doing these type of exercises, we could make it harder by having the platform move to work on things like being able to walk on a golf course or at the beach or even in their yard to get the mail. So those are some things that we can work on with this balance system.
And earlier we were playing around and you moved it, and it's very tough for someone who doesn't have a challenge at the moment. So it's not an easy thing. So this is a real great.
And that's something that we see as people age, is that their balance systems continue to decrease, and so they're not as reactive when they have falls. So that's something we want to work on to prevent falls. And
in our area, there is an elderly population, and that's a common problem. That we have here. We're going to take a look and check out another piece of equipment.
Yes, absolutely.
So this is another piece of equipment that we have at our leisure to use with our patients. This is called the BITS machine, and we have a lot of different avenues that we can use the machine with. A lot of it has to do with visual scanning or oculomotor control. And then we also have some assessments down here that we can use for quantitative information in order to track how a patient's doing during their stay. But I'm going to let you try out a couple of them. So this is trail making. And a lot of times we forget how much we use our eyes in everyday activities, and we need to be able to scan across an environment to see what's around us, be aware of what's going on around us. But with this whole screen, it's all touch capability. There's entirely touch capability. So you can start on the green dot, and what we want the patient to do is to connect 1 to 2, 2 to 3.
Like dot to dot, like when you're a young child?
Yes,
okay.
Yes. So we do this so much when we're kids, and then when we're adults, we lose those types of skills that we need. So I'm gonna have you start at number 1, and then hold your finger down and go all the way to 2. And you'll hear this bubble popping sound. That means you're doing it correctly. If you were to go to 6 next.
Let's try that.
It's gonna tell you no. So you get that auditory feedback.
Oh, wow.
But yeah, the goal of course is to go from green to red. And then once you're done, we're gonna quit the program. It'll end up giving you this quantitative report of how long it took you to do it. It'll tell you how many misses you had, and then we can use that going forward to kind of customize our treatments for the patients.
Yeah, neat stuff, fun, and neat stuff too. How do you keep the patients motivated if they get discouraged, down?
Sure. I think like we talked about earlier, one of the big things is just going back to things that they enjoy. And so like I've had a patient in the past that wanted to get back to horseback riding, and so we got out a bolster and practiced getting on and off the horse. And I'm sure Megan has some examples too.
Absolutely. Yeah. So handwriting is a big thing with the elderly population, that sometimes their fine motor starts to decrease. So we want to hone back in on those skills and maybe provide some adaptive equipment in order for them to be able to write again. If one thing doesn't work, then we go to plan B, C, D, and we always want to keep it changing and engage the patient as much as possible. So
yes. And we certainly sometimes utilize loved ones. If their spouse knows something in particular that they enjoy, then we can certainly use that as incentive and motivation too. We also have facilities where if they have a dog or a cat or something that they're wanting to come visit, they can have that to help incentivize and motivate them too. So that's a nice part about this facility. Yeah, make it feel a little bit more like home, exactly.
Yeah, well, we've enjoyed trying out your equipment here and hearing how you help patients and so forth. So you don't want to miss it. We've got one more segment coming up here from Encompass Health. And we're back here at Encompass Health where we're learning about all the wonderful things in the facility. And now we're talking to two of the nursing staff, Amy and Haley. Nice to meet you ladies today.
Nice to meet you.
You both have been here since the facility opened for the most part. Tell us about your roles.
Well, I'm Haley and I'm a nursing supervisor here, and what I do is I'm kind of over the day-to-day operations of nursing, and I'm there as a resource for if the nurses need anything.
How many do you have on your staff, nursing staff?
About 20 right now.
And do they typically work the traditional 12-hour shifts?
They do. We usually work 6:30 to 6:30, so 3 12s a week.
And Amy, what about you?
I do nursing education, I do a little infection prevention, and some wound care.
And what makes the nursing and rehab maybe different from other programs?
What I think about rehab nursing is it's really special because the patients are with us a longer amount of time, and we can really develop a relationship with them and get to know them and their families. And that knowledge we gain about them can really be applicable to their care. We can tailor their care to them specifically, and that'll allow their healing to progress more rapidly.
Yeah, that sounds great. You get to spend time talking
Correct.
with them, and all that is helpful. And just like you said, the relationship, and so much of that is relational in nursing and
Correct.
healthcare.
Yes.
Now you've got some special programs that you deal with, wound care you mentioned. Talk about some of those in detail.
Sure. So our wound care program, we have a nice team approach. We have nursing, we have physician consultant, we have the dietitian. So we can look at the wound overall. We look at prevention. We have a lot of advanced treatments, wound vacs, things like that. So if people have those types of needs, definitely in rehab we can service them.
So after a patient will come here after they've been in a regular hospital setting when their care requires more than home, right?
Correct.
So tell us a little bit about how that works. When might you see a patient after they get out of the hospital, come straight here?
I mean, we get patients from home as well sometimes, but the vast majority of our patients are usually, orthopedic, so they've had a broken hip, a broken knee or something, or we get strokes, traumatic brain injuries. But we are really receptive to a lot of different diagnoses, and we're willing to work with the doctors and the patients to meet their needs.
Well, safety is obviously important in any medical industry.
Correct.
Let's talk about how you implement some of those here.
Sure. Well, yep, that comes from a really good assessment both on the physician's behalf and the nursing staff. We gauge everything day to day, and I think what's paramount to it is rounding on your patients frequently. We have a, kind of a guideline here. Every hour on the hour, we look at the patient, make sure they're safe, and we kind of address those 3 Ps, pain, potty, and position. That way we can meet their needs. And like I said, we build relationships with our patients, so a lot of times we can come to anticipate their needs, and that way we keep them safe in that way. We know what they're going to do, and we can kind of prevent them from making those wrong decisions that could harm them.
Now you can spend a little more time with them maybe too, because they're here, like you said, 12 days in an average case, and get to know them, and maybe spend a little more time in their room with them versus a regular hospital where they're kind of in and out a lot.
Correct.
How does that work in the day-to-day for you? How do you find that beneficial?
They have their goals of therapy, and they're doing 3 hours of therapy a day typically, and nursing has them for the other 21 hours. So we're going to still be working on, what are their goals, their transferring, their mobility. It gives us a lot more time to do patient education. So their disease process, how to be safe in the home, how to take their medications safely. So it just gives us more time to cover those things, to make sure the patient really is comfortable going home, that they're going to have a safe discharge.
How do you work with the rehab team? Well, we just spoke to them earlier in the show. How do you guys work together?
We have a really nice team approach. The whole team meets once a week, talks about that patient's goals of therapy. We have huddles daily where our entire team collaborates and really just talks about, is the patient meeting their goal? What can we do to make it happen? If they're having difficulty with a patient, they let nursing know, and vice versa, so that we are keeping our patients safe, healthy. But one of the nicest things in a rehab setting is the collaboration.
And we were looking around a little earlier. You've got a special room here for family to come. Talk about what can happen in there. What is it used for?
Well, we call that our day room, and it's available for families and their patients to come together, so that family traditions can stay alive even when you're in the hospital. But it's also a specialized room that if we have patients that have difficulty swallowing or need a little more guidance with eating, staff can be there with them and monitor them and assist them for safety as well.
So they don't have to stay in their room and eat. Like if a family comes, they can get out of the room, they can enjoy another atmosphere, and that's so refreshing too.
It is.
For the family members as well, and it's a nice bright room and so forth. So you keep an eye on that. What else happens here in the nursing station?
Oh, there's a lot. We have a lot of physician collaboration. You know, those patients are constantly being assessed and monitored, making sure that everything stays within their parameters. We do some consultation family meetings, you know, different things like that. So really, it's just the same as an acute care hospital. We have all the same medical conditions and needs. It's just that we're keeping these patients a little bit longer to get them on that road closer to home.
How about how the doctors rotate in and out? How does that work as far as the scheduling? They come and visit with their patients. How do you guys collaborate with them?
Well, we have a medical director, and he does round daily on our patients, and he's very involved with the nursing staff. And then we have a multitude of other physicians that are there and collaborate with the medical director to meet our patient needs.
So if someone is being seen by a particular doctor, that doctor is obviously not here on site, they'll just come in and out and make their rounds, those visits. How does that all work?
Well, typically during the day there's always a doctor here, and they will see whatever patient is here to meet their needs, and then at night there's always someone on that call. And then we have physicians in the community that have privileges here that can come in and see for special needs like the wounds we've talked about, or nephrology for dialysis here on site and different things, so we can kind of keep patients' schedules here and they're not going in and out to different appointments.
Yeah, which is great,
Right.
for sure, and great for the family members. They can just
As
come
well,
here, so
yes.
it's a kind of a one-stop place for them. And as we wrap up, in just a few seconds left, any last words that you'd like to share with the viewers about the special thing about Encompass Health? What makes it so special?
You know, we love working here. We love our patients, and just getting them to meet their goals. I know that the patients who come here want to go home, and we want them to be successful with that goal. And that really feels good as a nurse. It's rewarding.
Yeah.
And I'm hoping it feels good for that patient as well, because usually they've been sick, they've been in the hospital a long time, and we're kind of that one stop right before them getting home and being safe, and that makes everyone feel good.
No, thank you, ladies, for sharing all you do and your heart and your passion for wanting to help people. And we thank you all for watching this episode of 843 TV, where communities come to speak.